Now, the South African Medical Association is outraged that many doctors working in the public health sector in Gauteng have not been paid their full January salaries. The association says urgent attention is needed to remedy the situation. The doctors working at the Charlotte Maxeke Johannesburg Academic Hospital are affected as well. To tell us more on this, the South African Medical Association's Akhtar Hussain joins us now. Mr. Hussain, thank you very much for your time this afternoon. Honestly, very disturbing when I saw that story. What is your understanding of the situation that possibly led to this non-payment of doctors?
Thank you very much for having me. Thank you, eNCA and the listener. The issue 2021, 2020, 2019, the Department of Health in Gauteng has been failing to pay the intern and community service doctors at the month end because they got a very funny way of working, and the HRs are failing to put them in the parcel system, salary system. What happened actually, they have delayed so much, they didn't put in their computer for the salary run. Now, more than 50 doctors didn't get their salary. Now, we wrote the press release, we phoned the Department of Health, they are saying we are working, but if you work 30 days, you need to get paid next end of the month. There are no negotiation of that. Now they say they are having some problem. Maybe third week of February or middle of the February we will pay. We don't accept that. They must get paid now, today. Of course, today is a Sunday, so maybe by tomorrow, if they don't get paid, we're going to lodge the complaint and legal action against them.
So, if I'm getting you correctly, sorry to interject there. Sorry to interject just there. If I'm getting you correctly, you're saying the department is saying there was a glitch in uploading them on the payroll? That is what they're attributing this non-payment to. What type of a glitch?
Truly speaking, they haven't done their job in the beginning of first week of January and end of December. Most of them took a long holiday and they came. And normally they run the partial deduction for the doctor's salary by 10th of January. That is, they didn't do it. And then they were blaming treasury, they were blaming funding, budgeting. So they have many excuses. I don't see there's any excuse they have. Their main issue is they are poor, very poor implementation, non-functioning HR, non-functioning Department of Health. And we don't want to believe that because this is not the first time in Gauteng. It's a last 3-4 years this thing is happening. So they need to really be accountable for this mismanagement of the whole health department.
No, it's honestly a bit disturbing, and the fact that they're saying they possibly could pay in 3 weeks. I mean, that luxury some people don't have. Every single cent is budgeted for and must be utilized, perhaps for some, immediately when it's month end. So it is quite problematic to assume that people have reserves. We really don't know people's financial situation. But have you engaged perhaps the National Health Department on this one, if maybe you're not getting any joy in Gauteng, since it's something that's more prevalent?
Yes, we did wrote our strong motivation letter to the National Department of Health, Director General of Health. And if we don't get response next 24 to 48 hours, we are going to write to the President Cyril Ramaphosa. This is totally incompetency and it's not acceptable by any means. Doctors, they got a bill to pay, they have to pay the rent, they got children, wife, rent, insurance payment, car payments. This is a disaster. Not only the disaster of health
workers. It's our frontline workers who are still in the middle of a pandemic. They continuously put their lives on the line for us. So really, for this to be happening is a bit disturbing, but hopefully we can speak to the Gauteng Health Department to get their side of the story, what possibly happened. But as for the doctors themselves, are they perhaps looking to leave the public health system, which would honestly compromise us, but are they perhaps exploring such at this point, just from being disheartened by the process?
The internship training of newly qualified doctor, we signed 2 years contract. to complete the training to get the independent practice. The issue is we cannot do the training any other place except the government hospital, academic hospital, and affiliated HPCSA, Health Professional Council accredited hospital. So this is going to be a lot of anxiety, stress, depression, and demotivation. Doctors are totally demotivated, working more than 240 hours per month. We're supposed to work 40 hours a week, 16 hours per week a call. It's not happening. If you check the total hour our doctors are putting in front line, it's more than 240 hours. On the top, 30 to 40% doctors are getting sick because of the COVID and the COVID variant and the Omicron, now B1, B2, B3 virus, new variant. Apart from that, the disease burden is so much in public sector. Tuberculosis, HIV, road accident, trauma, list is very long. So, and the shortage of doctor is not from today. There are no minimum critical number of doctors in a public sector. There are huge shortage. They are not appointing new doctors. They are only depending on the intern and community health service. So that's a disaster.